Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. Hello. I was off for a week or so, and I was celebrating another birthday. And so thank God for giving me 60 plus years and helping me to be blessed. I am excited to be back. I enjoyed my birthday weekend, which was on April 30th. So we didn't get to finish our allergy season. We're going to continue on. I'm going to be talking about allergic eosinophilic gastroenteritis. So we've talked about all the different systems that can be affected by allergies. And the first one that can be affected by allergies, I told you, was your nose. That's the most common one. Then we talked about how allergies can affect our eyes. And we discussed how it affects your throat, gives you that itchy throat, and drainage into your throat, clearing your throat a lot. And then we talked about our lungs. I can't breathe. We also talked about how anaphylaxis can occur if you have a severe allergic reaction and it causes inflammation of your throat and lungs and you can't breathe, and that's an emergency. We talked about that. Anaphylaxis will somewhat be tied to this one because we'll be talking about how food allergies can affect you, not just your gastrointestinal system, but everything if you have anaphylaxis. And I told you, call 911. Call 911 if you're having an allergic reaction. So let's get started because this one is a little bit lengthy. It has a lot of juicy information that will be good for you to get a better understanding of what food allergies are and how they affect you and what's going on. So allergic eosinophilic gastroenteritis, understanding and managing a complex condition. That's what we're going to be talking about today. So on our agenda is the introduction to eosinophilic gastroenteritis or food allergy, which can cause you to have sometimes what is known in layman's terms as bubble guts, making you have nausea, gassy, and feeling bloated, that kind of thing. Sometimes you can eat things, and as soon as you eat them, you've got to go. The next thing is the pathophysiology and the causes of allergic gastroenteritis, the diagnosis and how you test for it, and treatment and management for this condition. So in the introduction, I want you to understand that allergic eosinophilic gastroenteritis, we're going to be talking about this as a topic today for how in our allergy series, how the allergic reaction or overreaction of our immune system, the immune proteins in the gut can be affected by different foods. So in the stomach, you can get things like cramping. So anytime you eat something like peanuts, or you eat shrimp, or you eat strawberries, or you eat some type of gluten or wheat, it can affect your gut to where it overreacts, your immune system does, to that protein, and you start having problems. So over the years, we've noticed, and it's become apparent that we're becoming more sensitive to different types of food. Now, it could be from the manufacturing, from the type of fertilizer that's used, from chemicals that are used to treat things, or that are supplements and colors and things like that that go into the foods. Whatever the case may be, babies and children are being affected more often by food allergies. So, what happens when you have these food allergies? Who is being affected? We'll talk about that. But the definition and overview is you need to get an understanding that allergic eosinophilic gastroenteritis is a it characterizes the inflammation that occurs by the mucosal lining in the gut. Okay? That can be in your esophagus, this orange line here. It could be in the stomach. It could be in the intestinal lining. So it's connected with different foods because all foods have certain proteins. And this condition is often related to food allergies, which is the food proteins which you may be sensitive to, and your body would hyperreact to it, leading to gastrointestinal symptoms that can be, yes, distressing, giving you abdominal cramps. Gastrointestinal symptoms such as nausea, vomiting, diarrhea, heartburn, those type things, it can affect your quality of life. Now, I told you that the prevalence and demographics is starting to increase. Studies are showing that more children are being affected by this allergic eosinophilic gastroenteritis. Younger children, from the food they eat, as you can see here, and this little child has spread their food all over their face. This child here is being fed by food, and so what Gerber's putting in the food, we when you feed your baby, make sure that you don't just mix a lot of different fruits and mix a lot of uh, vegetables or meats into their diet. Do it slowly by giving them a particular food. So if you want to introduce carrots by themselves. When you do so, it allows the body to note that particular food entity and build up and develop the immune system for it. 1 or 2 weeks, you do that. And then after 1 or 2 weeks, then you add another vegetable. So say you want to add green beans. If there's no reactions at all for 2 weeks, 3 weeks with the carrots, and you then add in the green beans for 2 to 3 weeks, those two can be fed together. The next week, next few weeks, you would probably introduce a chicken or something like that and let the child try that. When you do the introduction of the food slowly over a few weeks, it gives the body time to build up immunity and to recognize and understand that that particular protein is coming into the gastrointestinal system. So I said that babies and children are being affected. So we have to understand that. You have to be careful. And if your child has problems with peanuts or different types of foods, you have to make sure that you let the school know. You have to make sure that you let your child know they cannot eat from everybody's lunch, because somebody may bring in M&Ms. And if those M&Ms have peanuts in them, there's a problem. Someone may bring in some fried chicken, and maybe their parent fried the chicken with peanut oil, and that child is allergic to peanuts. That's going to be a problem. So you need to let your child know, let the school know, let family members know. I said this when we were doing the anaphylactic talk. It's important to do so. All right. Now, symptoms and signs. When this is what you see on the outside, the large rope, the little small tail that you see on the left-hand side. When you're looking at your computer, you'll see on the left-hand side, it's like a little tail. That's your appendix. That's your appendix. And this is the right side of the colon. So that would be the ascending colon, going up, ascending. Then you have the transverse colon, which goes across the top of your screen. And then you have the descending colon, which on the left side. And then right under, in the middle, there's a question mark in there. That's just part of the graphics. I just thought that was pretty cool. So it's got a question mark there, but under that question mark, you'll see almost like a thumb that's sticking out. That is the rectum. That's where everything goes through that small intestines, goes into the large intestines, comes out and goes through the descending colon through the rectum. Okay. Abdominal pain. One of the most common symptoms of allergic allergic eosinophilic gastroenteritis is abdominal pain, which you would get extreme cramping, severe cramping. Then there's nausea and vomiting, which your body's at that time seeing, receiving, and understanding this is a protein we cannot take, can't deal with it. So what it will do is expel that particular protein, that food out by vomiting it out, expelling it forcefully out of the GI tract. So it really never gets to the colon. If you vomit it out through the mouth, then it's going to get into your esophagus. And once it gets in the esophagus, the mucosal lining starts to understand, hey, this is not something we can handle. We're going to get rid of it before it kills the organism or you. So it expels it out by vomiting. Nausea, you start to feel like you want to vomit. And that's where you would get dry heaves. Now, when you cannot eat a lot of things, you can start losing weight. So if you're having unexplained weight loss because you're not having enough food, you have to see a gastroenterologist. You need to see an allergist. You need to make sure that you get to your regular doctor and let them know what's happening to your body. Because if you don't, these symptoms will occur. And that's not something you want to keep dealing with. So let's talk about what is eosinophils. Let's discuss it. The eosinophils are found in the bloodstream. They are a protective organism that helps to defend the immune system. The immune system's response is to have eosinophils, and they are essential for your immune system by protecting the body. They actually combat allergic things and parasitic infections. the accumulation and the inflammation that can occur. If you have too many eosinophils, like you start making so much eosinophils because you are having reactions to so many different foods, then your body starts to have inflammation. That is swelling. Inflammation is a word for swelling or getting big. All right. So excessive accumulation of eosinophils in the gastrointestinal tract, that triggers that swelling. If you have a lot of swelling, then you can't get enough food in. If you can't get enough food in, then you're not getting the nutrients that you need for the rest of your body to function and to contribute. That will start to contribute to tissue damage. The impact of gastrointestinal health. So the presence of eosinophils is linked to various gastrointestinal disorders. We're only talking about one. I know there's irritable bowel syndrome, and there are other GI problems like Crohn's and ulcerative colitis. However, we're not talking about those today. They're all separate disorders, and because body imbalance is going to be on for a long time, we're going to be able to get into different things so that you will know what you're dealing with. But we're talking about allergic gastroenteritis. What causes that? So the allergic march, you can see in a baby, if that baby has a lot of eczema, and we're going to talk about skin rashes and patches and things like that on our next video. On our next show is going to be about eczema and how allergies affect the skin. But if your baby has a bunch of dry patches on their skin and it looks like leather, their skin looks leathery. On a Caucasian baby, it looks pink, salmon colored, and scaly. On a African American child, it's going to look like, if they're caramel colored, it would be a dark brown patch. If they're darker brown, you would see a thick, almost black looking patch on their body. Light skin will have more of a pink or a tan, brown, faded, thick, peeling skin. But we'll talk about all of that in our next video. All of that is created by having excessive eosinophils and if your IgE levels are elevated. So you see that with the skin patch, if you have a little baby and then they're having problems processing certain foods and they're always congested, having a lot of nasal congestion, they may be allergic to the milk that you're giving them. So you would have to, that's what that march is. It starts with skin, then it starts with nasal congestion, then it starts with them having gut problems. If your child is having some of these multiple symptoms, you need to make sure that you take them to the pediatrician and explain all of this. They may need to see an allergist, immunologist, and they may need to see a nutritionist if there's failure to thrive. They're not doing well. They're not gaining weight. So allergic triggers and the immune response. Let's understand what's going on with these allergens. Various allergens, including specific foods, can instigate, trigger a response in the immune system that's negative. It makes the body attack itself. So the immune response mechanism, the immune response can lead to an eosinophilic infiltration. So it's like an army. They're going to fight, but then after a while, they start fighting themselves and start fighting the organism, affecting the gastrointestinal tract and its health. Managing this, managing the allergies that occur, you got to identify and understand what your triggers are. And so that leads us to our next point. Well, we're going to stop before we go to the next point. We're going to talk about genetics and environment. If mom or dad have problems and you see the allergic march, started out with skin problems, then you have nasal congestion. And then there's the unified airway, which is the nose and the lower airway, the lungs. So if they're having problems breathing through their nose because of inflammation, they're probably having problems breathing through the lungs. And if there's asthma, if there's nasal congestion with allergies and there's skin patches, and now they're having problems with food, that's that allergic march. If mom and dad had those problems, genetic predisposition is something that you need to look at. That plays a significant role in the development of allergic eosinophilic gastroenteritis in individuals. Now, also environmental factors such as what we're eating, our diets, exposure to allergens. That's a crucial problem for those that are developing and starting, especially babies and children, because their immune system is lacking. It has to develop. It has to get introduced to certain proteins, and then it develops a immunity to those proteins. So the clinical evaluation and patient history. Patient history is mega important. I just told you if mom or dad had severe problems or grandma has severe problems, that's part of that patient history. So a visit to your doctor to be directed to an allergist or immunologist, or sometimes in this case, it would be to a gastroenterologist. That would be necessary for two reasons, because you want to get a good history about what's going on for further guidance to figure out what tests are the most important. What's the best test for you to obtain? What will help you to find out how we can best treat you? What medications will work? So you need to have a good history, and that will help guide testing. Set up for what is the next thing to do. So, what tests are out there? What are we going to do? What's going to happen to me next? Well, I'm so glad you asked me. So, the endoscopy can be done. Now, what you see on the top is a large camera. This here, they have two different types. One goes, they sedate you or put you to sleep, and one goes through the mouth into the esophagus. You remember that last picture that I showed you, the first picture that I showed you where it was highlighted in orange and there was that long tube. They have the scope will go through the mouth, go into the esophagus and down into the stomach, so that if you see this is the camera, that black rope looking thing, that's the camera. That's called an endoscopy. It goes through the mouth into the stomach, or you can go the other way. Go through the rectum and all the way up along that colon to look and see what you see on the left-hand side in the bottom. Those orange areas are pink tissue. Those are pictures that have been taken from looking at colon tissue. Okay, so they take little biopsies, pinches of tissue, send it off. So that's direct visualization. They look at it. You can look at it with your eyes through the camera and see if there's a problem. And you can also get pieces of that tissue and send it off to the lab for it to be analyzed. It can be analyzed to look for the eosinophils. It can look for cancers. It can look for bacteria. It can look for viral things. Laboratory test and imaging. Blood test Blood test, we talked about this. The blood test is the RAS testing, or the radio allergosorbent test. Radio allergosorbent test. That particular test is where they do blood, no pricks. They just pull your blood, and then you have to, the allergist, the provider, the PA, whoever it is, puts an order in for certain foods. When you get that test done, they don't put a test in and say food. You have to come in and say a specific food. Do you know how many foods there are in the world and how many different things people eat? You can't test for everything by just drawing the blood. You have to figure out. So if you came to me and I saw you and I said, well, what are you eating well, every time I eat oranges, my lips swell up. Okay, well, then I would test for oranges. But I'm not going to test for grapefruit. I'm not going to test for peaches. I'm not going to test for strawberries or blueberries unless you tell me those are things that you're having done. Now, they have some little blocks. So say you, every time you go to Red Lobster and you have lobster or you have shrimp, your nose swells up, gets stuffy, you start coughing, your throat itches really bad, and your lips swell up. Okay, well, I can do a seafood panel, but that doesn't cover fish. I'm only going to be covering shellfish because it's so many things that you can test for. Okay. And you also have to think of, now I'm going to say the cost, but I don't mean you can't do it because of the cost, or they're not going to do it because of the cost. But we're not going to look for strawberries if you never have a problem with strawberries. The common ones that they do is milk, soy, wheat, eggs, and sometimes strawberries, peanuts, and shellfish. They'll look for those because they're common things that people are allergic to. Skin prick testing. So over here, you see this man's back with all those dots. That's where you do the skin prick testing. Now, is one more sensitive than the other? The skin prick testing is a little more sensitive than the RAS testing, the blood test. And it gives it more accurate reaction. And it tells you, but it's a little more dangerous if you have severe allergies and you've had anaphylaxis in the past. People really don't want to do the skin testing for that reason, because it's actually introducing that particular protein that you're having problems with already to your body. So imaging studies such as x-rays or ultrasounds, they're crucial for looking at the gut to see if there's any problems. You can see that imaging study on the bottom. Those are some of the things that you want to look for when you are preparing for getting studies and things like that. Now, dietary modifications. Excuse me. Dietary modifications and allergy avoidance. Some things is just better to avoid it. If you have a seafood allergy and you've had an anaphylactic reaction, it's probably best not to eat at hibachi restaurants. I mean, you can go there and sit and watch the fire with the family and have a soda and drink some, but you sometimes can tell them they have to cook your food separately, let them know you have allergies. They'll cook it in the back. Elimination diets are essential for avoiding allergies that cause adverse reactions. That's just common sense. Rule of dietitians. Working with a dietitian can help you to make a plan for what nutrition you need and that what things you have to avoid. All right. I'm going to rush quickly to the end because I don't like to keep you all too long, but Pharmacological treatments, corticosteroids is very helpful. That helps with inflammation. That's like prednisone, but it has a lot of side effects. If you're diabetic, it can run your blood sugars up. But if it's necessary and it's needed, you have to take it. You just have to add insulin to your diet, let your doctor know so they can adjust your diabetic treatment and know that your hemoglobin A1C is going to shoot up. Immune suppressants. Immune suppressants may be helpful to manage and prevent the attack of the immune system on your body. However, you got to know medications like Dupixent and things like that, they're excellent for eosinophilic esophagitis. They're excellent for asthma, allergy, for nasal polyps, and all this kind of stuff. The issue is it can lower your immune system so you can get sicker easier. EpiPens, we talked about that during the anaphylaxis. Now, in conclusion, complex condition this is the allergic eosinophilic gastroenteritis. It has a multifaceted condition. You're probably going to need more than one provider to work with you and to help you with these symptoms. One may be an allergist, immunologist, one may be your regular doctor, one may be your gastroenterologist. Sometimes this can be so distressing to people, you may even need a psychiatrist because it's frustrating that you have to not be able to socialize with your friends and certain things and stuff like that because of this limitation. Importance of awareness, raising awareness about your allergic eosinophilic gastroenteritis. You got to let people know because I told you in the anaphylaxis problem or episode, it's important to do that so that you can keep people informed. They can help you. Ongoing research is needed on what you can do and why these things are happening. Research is helping people with this issue. This is our conclusion of this episode on how allergies affect the gut. I'm going to pray that you did glean a lot. You can always go back my channel and YouTube, on my YouTube channel, go back and look at some of the things that I have here to be of help to you. Until next week, where we're going to be talking about the skin and how allergies affect you, I want to pray that you got a better understanding and that your horizons were wide. Hopefully, your horizons have been enlightening.